All right, hello everyone. Welcome back to one of our workshops again. I hope you're having a good evening or morning wherever you are. Today we have Harvest, and he's going to present on an introduction to music therapy. And as always, we are streaming on YouTube Live, and the attendance quiz will be posted in the chat of both platforms at the end. So, Harvest, whenever you're ready, you can begin.
Sounds good. Thank you. Can I have screen sharing permissions, please?
Sorry about that. All right, it should work for you now.
Right. Okay. All right. Hello, everyone. I want to start off by thanking you all for joining me with Club Med today. I really appreciate you coming to spend 30 minutes of your day with me, and I hope that by the end of this presentation, you will learn plenty about what music therapy is as a career and field. Sorry, my camera was off. There we go. Okay, here we are. So this is what we will be discussing. We'll start off with a brief introduction of who I am. Then we'll move on to defining what music therapy is, discussing its unique benefits, explaining what music therapists are and the role that they play, and ending with examples of the use of music therapy in different intervention sites. So I'll start off by introducing myself very quickly. My name is Harvest, and I am a current high school junior in Texas. I am not a music therapist nor an expert. However, this year I had the wonderful opportunity of enrolling in my school's independent study program. As someone who has been playing percussion and piano for several years now, and also has general healthcare/medicine interests, I was initially having some difficulty picking a topic to study for the entire year because I could only pick one. But when I was introduced to it, I was incredibly intrigued by music therapy, as I initially saw it as almost the perfect combination between both of my interests. So since the beginning of this school year, I have been researching music therapy on my own, interviewing all kinds of music therapists, from interns to private practice owners to professors. And since the start of the second semester, I have been learning under the guidance and teachings of a board certified music therapist. Now, on to defining what music therapy is. Before I do so myself, I'm curious, based on your inferences or what you may know already, what do you guys think music therapy is? Feel free to type it in the chat. I just want to see what you guys think. At least for me, it's interesting to see what I thought of it before I learn more about it. All right. So I'm seeing how music helps your overall health and internal well-being. Yeah, nice. A way of healing through music, healing or calming a person using music as a way to cope. I like that one. Relaxation through music, to de-stress, exactly. Music therapy, music to treat mental health problems, music in therapy, helping emotions, release certain chemicals, which helps with mood. Someone knows something about music therapy, treating patients with dementia, overall health and emotional well-being, to help patients whenever you're stressed. Yeah, you guys have a really good idea of what music therapy is already. That's really exciting. An outlet to deal with mental health. Nice. Thank you all so much for participating. It's nice to see all your comments. Personally, I initially thought of it as a combination of both music and medicine. I mean, in my head, I was like, what more could it be? However, now I wouldn't necessarily call it the exact same thing because I found that it's much deeper than that. For example, music therapy isn't just combining music performance or music composition with diagnosing conditions or prescribing medication. In fact, music therapists do not and cannot diagnose or prescribe. Overall, they are very different from performance-based musicians and physicians. While it definitely takes general aspects from both sides, such as taking the use of an instrument and designing a course of treatment based on clinical observations, music therapy is its own distinct career and field. So the AMTA, or American Music Therapy Association, defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music therapy is an established health profession in which music is used within a therapeutic relationship to address physical, emotional, cognitive, and social needs of individuals. So you guys were pretty spot on with all of your guesses. My personal favorite way to explain what music therapy is almost like a cycle. First, a concern is addressed, then the music therapist will incorporate music interventions to then accomplish non-musical goals. And this occurs until all the goals are met. As an example, say someone has a speech concern that they or their guardian may want to address. This is non-musical. A music therapist will then have them sing their favorite song, which is obviously musical, and soon it turns to talking and regular speech. And this is the non-musical accomplishment. So hopefully you guys kind of see that cycle there, starting with non-musical, moving it to musical, and then it transfers to a non-musical accomplishment. And this is a very basic illustration, so it requires some extra background knowledge. Firstly, the extent of which the effects of music therapy are shown in every individual is very different. In fact, sometimes music therapy may have no effect, or sometimes very rarely a worse effect on some, but I assure you that this is only in the most extreme cases and it really hardly ever happens. But it is kind of similar to how certain drugs can sometimes cause allergic reactions, or it's simply not accepted by the body, which requires another drug or another course of treatment. As with anything, not everything works for everyone, but when it does, everyone has their own unique reaction. Secondly, a core pillar of music therapy in terms of long-care treatment is the completion of assessments by a therapist in order to determine whether or not a potential patient is quote unquote qualified for music interventions. In essence, before giving treatment, music therapists will conduct almost a diagnostic of sorts to test, is this patient compatible with music therapy? Are they actually improving when it's given? How are they reacting to that specific therapist? And so on. This may take some time and can be a difficult process as it is the first time a music therapist is interacting with that specific patient, but it is extremely critical to ensure that music therapy is the right course of treatment. And if passed, this assessment will then help the therapist to make specific goals to accomplish all throughout treatment. And this strategic goal setting is what will help them guide in deciding how to approach all their different concerns. The AMTA also clearly states some examples of what is not music therapy. So we have a person with Alzheimer's listening to their favorite songs on their phone, a piano player in the lobby of a hospital, people who call themselves bedside musicians, musicians on call, music practitioners, nurses playing background music, high schoolers playing guitar in nursing homes. And while these things are all very good, they just don't match the definition of music therapy because they lack a credentialed professional. Now, onto the specific benefits music therapy serves to offer. Back to its definition, it is the use of music interventions to address really any physical, emotional, cognitive, or social concerns. This means that the demographic it fits is very wide. Patients can be of all ages, all ethnicities, all conditions, and more. So anyone from, say, infants in the NICU to geriatric patients in end-of-life care, to adolescents with intellectual disabilities, to adults with physical trauma, or cancer patients with emotional distress, or teenagers struggling with depression. Music therapy can be so helpful for so many people. To name even more, it can help in Parkinson's disease, PTSD, dementia, and Down syndrome, among others. One commonly asked question is, do patients have to have an extensive musical background in order to do well in music therapy? And the answer is no. In fact, no sort of music background is required whatsoever, and having one doesn't really provide any sort of advantage over others in regards to reaping the benefits. Another benefit, so we talked about the demographic it fits, it's very wide. Another one is neuroplasticity. Over time, music therapy helps to promote neuroplasticity. This is the ability of the brain to rewire itself and create new connections. So for that person with speech concerns that I introduced earlier, music therapy helps to create new pathways and new connections that make speech easier for them. If you think of speech therapy or even physical and occupational therapy, those focus on the actual physical aspect of performing that task. But music therapy focuses on the individual's abilities neurologically to think through and then perform that task. You'll also see music therapists working alongside physical occupational speech therapists as well. Also, music therapy is what I like to call comprehensive or all in one. A great thing about it is that it takes aspects from so many fields. So, with the four concerns that it works to improve physical, think of, say, hitting a drum, playing a woodwind instrument, or blowing through a brass instrument to improve and grow upon fine motor skills, as well as breathing skills. With cognitive, think of composition, as well as the act of playing an instrument, which does require a great deal of learning. With emotional, think of expressing oneself through lyrics and song and purposeful listening to songs to help process thoughts. With social, think of the interactions, with a music therapist or other patients. Music therapy is also very versatile. Another commonly asked question is, can only classical music be used in music therapy? And the answer is no, as any genre of music from classical, pop, country, even rock can be utilized during music therapy treatment as long as they are conducive towards improvement. Therapists will also take into consideration patient preferred music in order to allow the patient to make their own decisions during therapy. And the same thing goes with instruments. As long as they promote productivity, anything can be used. And more recently, music therapists have been doing sessions through telehealth. So household items have been adapted into instruments, as not everyone has access to traditional ones. Also, almost everyone, not everyone, but almost, no matter where you are, you have access to another instrument, your voice. However, it is important to know that in a regular setting, no pandemic, piano, guitar, percussion, and voice are among the most commonly used. Also, the frame of mind during music therapy sessions. Music is such a huge part of a lot of people's lives. And if you're anything like me, you listen to music every day in some sort of capacity. Therefore, in treatment, it's often seen as casual and familiar. Compared to physical therapy, which can be quite exhaustive at times, music is just one of those things that is, in less scientific terms, just very human. It touches people and communicates on a completely different level. And it allows patients to view therapy as something fun and not something super medical. Now, on to what music therapists are, why they're needed, and the role that they play. As stated in the AMTA definition, music therapy utilizes a credentialed professional. This is essential because the music therapist will guide music interventions in a way that purposefully leads to favorable outcomes. For instance, you may think, well, I find listening to certain genres quite therapeutic. Why is a music therapist needed? Without a therapist, there is no music therapy because long-term progress is not being stimulated. While I admit listening to a particular song or playing an instrument can be very beneficial in a given moment, it doesn't match the definition of music therapy because it lacks a professional guiding purposeful interventions. So music therapists guides productivity because they know how to manipulate certain dynamics, timbres, tempos, harmonies, rhythm, pitch pulse, all kinds of aspects of music to best stimulate progress. Onto the training required to become a music therapist. The road to becoming an MTBC, which stands for Music Therapy Board Certified, starts with the completion of a music therapy bachelor's degree under an AMTA approved program, which focuses on musical foundations, clinical foundations, and of course, music therapy foundations. One commonly asked question is, can I pursue a music therapy major anywhere? Unfortunately, the answer is no, as there are a limited number of schools that offer these courses. However, there are alternatives to this. If you are enrolled in, say, a major in a related area like music, but not music therapy, just any kind of music or psychology, then you may be eligible for what's called an equivalency program. This does require some music therapy requirements to be fulfilled afterwards, but it does allow those who don't have music therapy majors offered at their school, or even those who have already finished their bachelor's in a related area to pursue music therapy later on without that music therapy bachelor's degree. And at the same time, 1,200 hours of clinical training and 6-month internship is required. And this gives music therapists in training extensive hands-on application of knowledge in all kinds of settings so that they are best equipped with as much hands-on experience as possible. After the initial 4-year collegiate education and clinical hours, the next step is taking the certification exam, which earns that MTBC title. After that, there are master's degrees which focus on advanced practice and research, as well as doctoral degrees which focus on even more advanced practice and research, as well as education as a professor. These are, although completely optional and not required to become a practicing music therapist, you only need that bachelor's degree in music therapy or equivalency program and the certification exam. And it is crucial to know that every therapist has their own principles of how music therapy should be and can be implemented. Each university or program has their own school of thought. So it is important that you know that if you were to go from therapist to therapist, you may hear slightly different things about their philosophy. In regards to its purpose, my research and guidance from my mentor has led me to the idea that music therapy is never meant to treat or to cure. It's not meant to replace any kind of big medical procedure or prescription, but it does have a myriad of benefits that no other therapy can offer. Earlier, I talked about the use of assessments before interventions are incorporated in order to determine its potential efficiency. However, assessments do not stop after the initial one. All throughout treatment, assessments are made even before, during, and after sessions, and this is to ensure that each method or technique is at its maximum efficiency. Music therapists will also continue to assess goals. Whether or not they have been met, this will show them what is working and what isn't, other ways to approach a concern in order to accomplish that goal, and to see if actual progress is being made. Furthermore, while music therapy may seem appropriate at the beginning, it can have the chance to almost wear off in a way, either as kids grow older or no longer respond the same way, or as adults progress significantly to the point where it's no longer needed. Now, this brings us to the music interventions that music therapists use, which fall into 4 main subgroups. The first is receptive, and it may be what you think of when you think of music therapy. For example, you may have seen some videos of particularly elderly listening to music from when they were young and how they lighten up when they recognize a song. Receptive is where the therapist plays music, whether live or recorded, and facilitates lyric analysis in order to induce relaxation, enhance the emotional state, and practice listening skills. The next is recreation, or just music making. This is where the patient will play instruments or sing a song based on familiar or new music given by the therapist. This facilitates social interaction as the patient and therapist take turns playing different phrases, builds upon motor skills as different movements are required for different instruments, and allows for self-expression. Third is improvisation, and it's pretty similar to recreation. This is where the music therapist must analyze the patient's specific mood at that time to then allow for productive, spontaneous music based on different motifs given by the therapist. And this helps to practice free decision making and relationship building. Lastly is composition, and it's exactly what it might sound like to you. This is where the music therapist guides an individual through the creation of their own songs and own lyrics. It aids in validation of their emotions, expression, and of course, creativity. Now, onto what sessions may look like. They can either be one-on-one or group-based. And there is no particular group to having over the other. If you're in group-based, it doesn't mean you're getting less attention. It just really depends on the specific needs of an individual. For instance, if they have more specific concerns, need special attention due to their specific medical diagnoses, or do not find large groups conducive towards improvement, then sessions will generally be one-on-one. But if they need to address social concerns and need practice with interacting with others or turn taking, then sessions will be in a group. Now on to settings where you may find music therapists. There truly is no limit to where music therapy can be quote unquote administered. You may see them in hospitals. This is where they focus on medical concerns like motor skills or even the emotional state of a patient. They can also be found in nursing homes or hospice, and this is where they focus on end-of-life care through elevating moods through familiar songs. You may even find them in rehabilitation centers, juvenile detention centers, or even prisons. And this is where they address emotional concerns and trauma. There are also music therapists in schools where they focus on a child's learning skills and abilities. A lot of music therapists also own or work in private practice. So private practice, their focus will change from each one. Now, on to examples of the use of music therapy in various intervention sites. First, the use of music therapy in autism spectrum disorder. For some background, autism or ASD is a neurodevelopmental disorder commonly characterized by difficulties in social skills and communication, sometimes causing repetitive and restrictive behavior. However, music therapy has historically been seen to improve social skills through practice of social engagement, joint attention, verbal communication, initiating behavior, and social emotional reciprocity. This is because music helps to activate neural networks and synchronize neural firings. On the more musical side, songs help. Songs guide confident speech, group analysis stimulates social settings, call and response teaches turn taking, and composing promotes high cognitive thinking. Music therapists can also manipulate musical phrases to be more predictable, which helps with anticipation and impulse control. They can even make phrases unpredictable to help combat sensory overload. Also, those with autism tend to have a strong attraction to music, which helps even more in settings, as many respond very positively. Next, on to the use of music therapy in neonatal intensive care unit, or the NICU. Neonates are obviously very sensitive to their external environments, and because this period is so important for proper neurodevelopment, optimal conditions must be maintained at all times. Sound is a major external factor, as chaotic sound can sometimes cause stress and disruption in development, while the complete absence of sound can actually lead to language delays and social deficits later in life. And music is a way to productively use sound to promote plasticity and maturation of the brain. Music can also decrease cranial pressure, induce peace to improve sleep, and increase oxygen production. Because it establishes a strong relationship with the parent with trust, music therapy also stabilizes emotional skills along with language, cognitive functioning, and memory. Music therapists hold the importance of live music as they can control all the different intricacies of necessary rhythms, pitch, timbre, pulse, melodies, and timing of intervention as compared to, say, recorded music. Still staying within the hospital, but moving on to a different group, we'll now look at music therapy among patients post-surgery and those with cancer. Music therapy has been shown to stimulate the cerebral cortex to reduce stress-related hormones. I saw that someone guessed that earlier. Reduce cortisol levels, stabilize blood pressure and heart rate. Music also has a special way of serving almost like a distraction, as it comes with a pleasant association, relieving people of physical pain and anxiety. All of these benefits are transferable to patients all throughout the hospital. And in fact, it is a recognized form of established integrative oncology treatment. And this is because it works to improve the quality of life by reducing negative emotional influences. As with post-surgery, music therapy among cancer patients distracts them from physical pain and emotional distress. It reduces feelings of anxiety and depression, and overall facilitates a healthy recovery. So obviously it's not meant to replace surgery or chemo, but it makes sure that they are on the right path towards recovery. Now, shifting away from hospital use, we will look at the use in delinquency involved juveniles. Art-based rehabilitative therapies like music therapy have actually historically been used all around the world for at-risk youth, as it serves as a medium for creative expression in a non-threatening environment. Here, music therapy takes what is called a positive psychology approach, where the focus is on the individual's abilities to build their own strength to battle their inner conflicts rather than environmental factors creating the issue. Through lyric analysis, music learning, and composition, music empowers youth to work through their own traumas, improve self-worth, confidence, emotional resilience, and stress coping strategies. I also saw someone else guess that earlier too. Now, before we end, I would just like to show you guys the website that I have made. You can find it at mtstudents.wixsite.com/info, and it serves as a supplemental resource for students curious about music therapy. I have basically all the information that I talk about here, the benefits, how to become music therapists, schools offering music therapy. So please go check that out if you guys are curious about music therapy even more. There are also countless videos on YouTube's by hospitals and universities documenting people's testimonies. I even saw one by Pfizer, which was pretty interesting. You guys should go check that out. Also, I encourage you to visit the official American Music Therapy Association website at musictherapy.org. That is the perfect resource. There you can find almost everything you need to know about music therapy. Also, the National Center for Biotechnology Information, as well as the American Psychological Association, has numerous easily accessible studies and articles for if you want to learn more about music therapy in more specific settings. All right, thank you all for joining me today. I really appreciate you all for coming and giving me the opportunity to tell you about music therapy. Because it is a growing field, there are a lot of misconceptions about what music therapy is as a career and field, but I hope you will be able to leave today knowing a lot more about it. Thank you guys.
Um, yeah, so thank you so much for that presentation. I definitely had no idea what music therapy was at the start, and now I feel like I learned so much about it as everyone else has. Does anyone like have any questions or anything? Please feel free to ask them. And I'll give it a couple minutes for that.
So I see, is music therapy beneficial for all age groups? Yes, it can be used in all age groups. So from infants in the Nicu to patients in geriatric care and nursing homes, it's such a wide range of people. There really is no limit to who can benefit from it. Great question. Yeah, definitely. It's amazing how music therapy works. Oh, and I'm seeing some questions, direct message. When did you start playing music? I started playing the piano in third grade and percussion in fifth grade. So a few years now. I started playing through my school. What type of music is most commonly used? Um, there isn't one specific type that is most commonly used because it's such a wide range, really whatever works best for the patient and what stimulates the most progress is used. Specifically, I know in schools, they'll generally use folk songs, children's songs, really anything. A lot of pop songs are also used because those are seen as more relatable or more current. What types of tunes are the most relaxing based off of demographics? For patients in the NICU, it would be more peaceful songs, obviously, more quiet songs, mainly instrumentals, or also those with soft lyrics, very quiet. And really anything with lyrics for more advanced age groups, those provide even a more complex and deeper um, connection with music. So those with deeper lyrics and meanings behind them will be used for older age groups. And for elderly, I would say more memorable music from earlier on in their ages would definitely be more relaxing for them. It definitely helps to calm them down. How much would it cost to hire a music therapist or attend sessions? That's a great question. I actually do not know the answer to that, but I will be sure to add that to my website. Um, at least I know my therapist, she works in school districts, so it doesn't really come at an extra cost for those music I'm sorry, those attending music therapy sessions in schools because it is a part of their IEP. But that is a great question, and I will definitely look into that. And it will vary from practice to practice. How accessible is music therapy? That's a great question. Are you referred by other physicians or do you seek it out yourself? So for that, generally you would seek it out yourself. You may have to different so my I know a little bit more about school districts because that is what my mentor, she works in school districts. So I know some, they may offer music therapy straight, like right when they sign up for their IEPs. But for others, you may have to go through a little bit more finding to enroll yourself or attend music therapy sessions. But I have not heard of physicians referring music therapy. I do know some hospitals who they offer it. Some hospitals, they say, oh, would you like a music therapist to come? So it's different from place to place. What do you think the future of music therapy would look like in various settings? That's a great question. Um, right now, music therapy is making great advances in its use in the hospital. Right now, it's not as commonly seen, but definitely in the future, I see it advancing a lot more and being more recognized, more easily accessible and offered. Also in schools, I see it really advancing in schools. I personally didn't even know that my school district had a music therapist, but I definitely see it just advancing in those two specific areas. It's definitely more established in um, end of life care though. But I see it advancing in all different kinds of age ranges and all different groups and conditions. How new is music therapy? It's the first time we've heard about it. Great. I'm so glad I was able to tell you about it for the first time. It's fairly new. It's a very rapidly growing field. The AMTA was actually established, not sure the exact year, but very recently, I think around in the 2000s, beginning 2000s, there were a lot of developments being made in establishing the AMTA. I think I've also music interventions have historically been used for ages now, but specifically the established career and field of music therapy, I believe the 1950s and then 2000s is when the AMTA was formed. I'm so glad you think it's really cool. I think it's amazing as well. Thank you all for all of your questions and comments. It's really encouraging to see all of your what you think about it. And like I said, if you guys, or I don't know if I said this at the beginning, but if you guys would like to visit my website at mtstudents.wixsite.com/info, that I do have a section to, if you have more questions that you have later on. Thank you. I'm so glad you learned a lot. Oh, someone asked to go to the slide for juvenile detention centers, of course. Here you go. All right, I'll give it a couple more minutes of questions if you guys have any more. All right. I think that's all that we have time for today. Thank you all so much for joining. Make sure to fill out that attendance form. And if you have any questions, please feel free to contact me through my website. Thank you so much.
Thank you so much for presenting. This is definitely super enlightening, and I'm sure everyone, as well as I did, learned a lot about it. As he said, everyone please fill out that attendance form. And if you have any questions, please let us know.